So I'm here today with Dr. Elena Zinkov, and Dr. Zinkov is a trailblazer in women's health. This is going to be so exciting because Elena has been redefining how women navigate their health journeys with a science-backed, very holistic approach. So, like me, she's a naturopathic physician. She's also an entrepreneur and the founder of Proactive Health. And Elena's really dedicated her career to empowering women to thrive at every stage of life. So today we're going to be exploring how vitality impacts your capacity to be in touch with your sexuality and your aliveness, which is a different spin on how the rest of the series has gone. So, Elena, thank you for being with me.
Thank you so much for having me. This is such an exciting topic.
It really is. So, what I'd love to dive in with is, if somebody did come to you and say, I just lost my mojo and I don't know where to find it, from the perspective of hormonal health and some of your other, like, you have a very cool toolkit around vitality. Where do you start to explore first?
Yeah. Well, most of the time, I find that women start to lose the feelings of self-confidence and the feeling of being themselves and comfortable in their skin and also feeling connected with their partner. Mid-30s is when it starts to decline. And for someone who can start earlier, our hormones can start to decline after the age of 24. So it's not surprising when you see a 27-year-old who's complaining about potentially low libido or signs of low vitality. But a lot of women, when we enter perimenopause, when our hormones start to shift, we can start to lose the edge that we had before, and it can start to manifest in many different ways. For some women, it's just a lack of energy. For other women, they don't feel like they have the go-getter attitude that they had in the past. And that can start to trickle into even our intimacy and how we feel in the bedroom and leading up to that moment during the day. So, usually, when I hear a woman complaining of those symptoms, we start to look at hormones as one of the first places. I'm usually assuming that a lot of other workup has been done, that there's no like malnourishment, that she's in a safe place and in a great relationship and marriage. And of course, when we start looking at the different hormones, and particularly the sex hormones, actually surprisingly low thyroid is associated with a drop in libido and vitality. Because when we think about sex hormones, we think about like testosterone. Yeah, if we get that up, we're gonna be perky and energized and feel alive. But in reality, it's a combination of hormones.
Mhm.
And everything can start from higher up and have an effect downstream. So I really do a careful evaluation of things like thyroid and adrenal health, making sure that they're not constantly in a fight or flight mode, right? Because we can be in a fight or flight mode and feel amazing and awesome. We're either thriving or surviving, so to speak. And then I really have to look at those sex hormones like the testosterone, the estrogen, and progesterone. For some women, their testosterone could be fine, but their progesterone stinked. And that's what doesn't make them feel very good. They feel more stressed, they feel more on edge, they don't feel comfortable in their own skin. And estrogen, when it's all over the place, whether it's high or low, can just make you feel like a raging diva. So I really want to do a dive into the overall hormonal health to get an idea of what's happening.
Fantastic. I love the comprehensive nature that you take things. So, when somebody's thyroid is off, right? I mean, it's clear. It's like, well, typically we give the thyroid hormone, but with the reproductive hormones, sometimes we go straight into hormones and sometimes we take a botanical approach and kind of do other things. So, how do you
Yeah,
navigate this dance? Like, what are your favorite paths
yeah.
forward?
I love this. We actually, as we're doing this interview, I did this post on Instagram and it went wild. And there were so many opinions about how do we approach, let's say, low testosterone levels. because everyone has opinion and everyone is entitled to an opinion, but we want to make sure that we're approaching this not from a personal bias of what worked for me is going to work for everyone else. As naturopathic physicians, we don't take a weekend course in hormone replacements. We treat the whole person and we introduce hormones in that fashion, in the therapeutic order, so to speak. So I look at the age, right? Is this a time when I normally see the hormones start to decline? And is this a time when I may introduce an herbal therapy? And if a woman is in her mid 20s, we sometimes see that things like even maca can improve testosterone levels naturally, that things like tribulus
Hmm.
can improve testosterone levels naturally. I don't necessarily have to go straight to testosterone therapy. Now, if I'm working with a woman who's maybe 45 years old and I'm starting to see that her testosterone is starting to dip and maybe it's in the low 20s or starting to dip into the teens, I might say, you might not be able to produce anymore. We might try to stimulate your ovaries and your adrenals to produce some testosterone because between between the ovaries and adrenals, it's about 25% each that they're producing the testosterone. And so, unlike estrogen and progesterone, which is predominantly our ovaries, so there are things that we can do to naturally stimulate testosterone production, but the likelihood that we're going to get it to anywhere significant is low. So I look at age, I look at levels, and I decide whether we want to try a more natural approach or if we want to try a more natural approach and a little bit of a testosterone therapy, preferably in a cream to start out. We don't want to overload the receptors. And sometimes if the herbs are not doing anything, then we resort to actual just testosterone therapy as an example. And that's really similar to all the other hormones. And I've had the privilege to work with women from all phases of life. We see babies turn into toddlers and perimenopausal women go into menopause and postmenopause and kids going to college, graduating from college. So some women will especially in perimenopause, will do better with a lower intervention approach. And as we get older and as the hormonal landscape changes, then we start to ease into the hormone replacement.
Yeah. So one of the things that I'd love for you to talk about, I don't want to take us too far off the path of sexual desire, but I think it's so important because something that I've heard you talk about a lot, and I really admire you for, is that you believe that all women can be candidates for hormone replacement therapy.
Yeah.
And I just like, as we're talking about this, I'm imagining that some women are going to be listening and going, well, that's great for somebody like this, but not me. And so, can we briefly take a detour into why hormone replacement, when properly prescribed, right? A very important
Right.
caveat, but when properly prescribed, could be available to all women who feel the need?
Absolutely. You know, 100 years ago, an average lifespan for both actually men and women was around 53, 54 years old. Like we really technically could get away with not having hormone replacements. Now we're living on average about 25 years longer. We need hormones. We're living longer. So the longevity piece is in place thanks to emergency medicine, right? We can bring someone back to life, but can we keep them alive and also healthy at the same time? And I see hormones as an essential part of our toolbox and our toolkit to help women thrive. Majority of women have heard things from their physician, like we can't test hormones because maybe a woman is in perimenopause and her hormones are fluctuating. Her hormones are fluctuating. We know, in fact, that that's not true. Some physicians will say, well, you're not in your reproductive years. Why do you need the hormones? As if we need the hormones just for reproduction purposes. We need hormones for brain health, for cardiovascular health, for bone density, for metabolic health, and the list goes on and on. And probably one of the saddest things that I hear from women is women with a history of breast cancer or ovarian cancer or other forms of quote unquote, for those who are listening and can't see us, but for cancers that have been put under the umbrella that it's hormone driven, when in fact many other factors were not taken into consideration. And those women have been put on estrogen blockers and have been condemned from any sort of hormone replacement therapy. And so a lot of women will say, I've had this history or I have a strong family history. I cannot be on hormone replacement. And I've talked on the subject a lot. I have colleagues who are breast oncologists who worked with women post breast cancer. And the research is there that hormones are actually, when in balance, are cancer protective. Progesterone is cancer protective. It stops proliferation. It prevents what estrogen can do, which estrogen is all about growth and progesterone is all about containing that growth. Testosterone, there's tons of research that actually for women who are very shy towards hormone replacement and need more confidence that something that they're going to be on won't increase their risk of developing breast cancer, as an example, tons of research that testosterone is very breast protective and that actually women who are currently undergoing cancer treatment can safely incorporate testosterone therapy along with, a little bit of an estrogen blocker. Their quality of life improves significantly. So we have to understand that women can experience a hormone imbalance at any stage of life. I started hormone replacement postpartum when my progesterone was not completely tanked, but I was so estrogen dominant. And no matter what I did, being a naturopathic physician and trying to do lower intervention things, I was losing hair. I had double whammy of two autoimmune conditions. And we know hormones, they drive inflammation or control inflammation, impact our immune system. So frankly, I wish I was on hormone replacement earlier. It would probably make my 20s a lot better. So for women who are thinking about hormone replacement and who want to feel alive because maybe their testosterone has been tanked for so long and they want to reignite their passion and their sex life and their intimacy because maybe they're working already with a therapist and they're working with their partner on improving their love life, but this could be the missing piece. Don't be afraid of these therapies.
Yeah. Thank you for saying that because I know it's like a deeply instilled concern at
It
this point.
is.
And I was just thinking, like, someone's not going to even be able to hear our conversation if in the
It's like,
back
la
of
la
their
la.
head is they're like, I'm not a candidate for that. And since we're talking about hormones and vitality, I'm curious because you do a lot of longevity medicine, right?
Mm-hmm.
So I think probably in your practice more than mine, people actually come to you and they say, I feel great, but I'd like to stay this way.
Yeah.
Whereas I find that in my practice, people tend to come to me because they've already got the anxiety or the hot flashes or like something's happening. And so I'm curious when it comes to this conversation around radical vitality, if somebody's not symptomatic, but they are perimenopausal or menopausal, how do you approach hormones then?
Yeah, absolutely. Well, I always say that even if you feel like you don't have a hormone imbalance, chances are if we test your levels, we're going to start seeing some changes.
Mhm.
And we want to keep people optimal. So I find two things. One, we can start to see suboptimal levels or some sort of imbalances in the hormone panels. And when we incorporate, and this is the second part to this, and when we incorporate, let's say a little bit of even something like testosterone, a little bit of progesterone, whatever that imbalance is, or even add the progesterone to estrogen ratio as an example, women will frequently find that they almost forgot how good they can feel because it wears on you. I feel fine. Like I'm not losing my hair. My cycle seems to be regular. Okay, I feel a little fatigue every once in a while because we've got maybe two kids and we're corporate athletes, but who doesn't feel that way? So we kind of start to normalize these things. And slowly we're like, we don't feel awful. We feel pretty good. But when we start to optimize, we have a new ceiling. And that's pretty cool when I work in the longevity space where women all of a sudden are saying, wow, I forgot that I could feel this good. And they're starting to push the boundaries of what's possible in their personal life and in their professional life.
Yeah, that's so great because I see that so much where we live in a culture where it's so normal It's so common, I guess I should say, not normal, but it's so common for people to feel like shit
Yeah,
that
totally.
they're
I
looking
get
around going,
sleep.
yeah, I feel as good as everybody else that I know. So what's the problem? And I actually hear the same thing expressed with regard to sexual desire. Like, I don't know anybody that wants to have sex. So what's wrong with not wanting to have sex? And so I
Yeah,
love this approach of like, sometimes we put the things back and there's like a waking up inside. Like, oh, I remember that woman. I remember being that woman and I get to be that woman again. So, Elena, what do you think about peptides when it comes to this conversation around vitality and
Mhm.
around desire? Do you always think hormones? Or, because you play in the peptides again way more than I do. Are you often thinking like, let's push the metabolism or the body composition, like let's shift something about that experience? So, yeah, tell me about that toolkit a little bit and how you see some of those tools playing into how you might support somebody in rekindling that flame.
Definitely. So we always start with a foundation. Peptides is not necessarily the first thing that I jump at. There are many different peptides, like many people hear about oxytocin as an example. Peptides, a lot of them we actually naturally produce. Like let's think about insulin as an example. Oxytocin is one that I find I do prescribe pretty frequently, but when I'm working on improving someone's sense of well-being and vitality and confidence, I work on the foundation first. We want to make sure that people are lifting weights and working on their diet, and working on their stress management, they're sleeping well, and we improve their energy. And how we improve that energy, sometimes it's the hormonal piece. And that's sort of the next step is once we have the foundation in place, that terrain in place, then we potentially address the hormonal imbalances with hormone replacement if needed. And I usually treat peptides as like the cherry on top of the sundae. So everything is already pretty good. Or if it's not good enough, if we're not seeing the changes, if we're not seeing the changes in our metabolism, because for a lot of women, feeling good in their own skin can mean losing maybe 20 pounds that they gained in perimenopause without changing anything. I mean, you probably see this and hear this all the time. I did not change my diet. I've been doing the Whole30. I've been hitting the gym. Where did the 20 pounds come from in the past year? What does that do to our confidence? It brings it way down. Now we don't feel, and we might necessarily even um, feel kind of you and I were talking about, we don't necessarily feel bad, but it does do something to our confidence, obviously. Things don't feel the same, our joints don't feel the same, right? And so we do incorporate peptides sometimes in the form of GLP-1s or GIPs or a combination of them. This includes like semaglutide, tirzepatide, or tatratide. There's a bunch of different ways that we can improve the metabolism. And what I find, and this is what I talk about all the time, but this of course gets missed because everyone is so focused on the weight loss component, is the impact that something like GAPs and GLP-1s and a lot of these weight loss peptides, the impact, the positive impact that women experience on their mood. And it's the first time that they feel like that constant chatter in their mind has been off and that they can make the decision, not the cravings, but they can make the decision in their life. And the way that I like to pair these different peptides is when I'm working on improving sense of strength and confidence and sleep and even skin health and hair health, really helping women feel whole, is the growth hormone peptides, because those start taking in the second decade of our existence after the age of 20, probably before even the hormones start tanking, our growth hormone starts to tank. And then the hormones follow, the rest of the hormones follow. So I really like to use a lot of the peptides that improve our metabolism, but also support lean muscle mass and that support our mood and our strength and our sleep, which
So
all
are we talking like sermorelin at this point? Or do you
Sermorelin
have
and
others?
yeah. So sermorelin is a nice one. It's a nice, easy one to start out with. The other ones are like CGC, ipamorelin, and tesamorelin. So peptides, especially the growth hormone peptides, it all depends on the level of stimulation that we want to achieve in terms of how much growth hormone we want to actually produce. These are not synthetic. So in some cases, you'll see, oh, it's like a synthetic hormone. They stimulate your own ability to produce growth hormone. And the nice thing is that even someone who flat out has a growth hormone deficiency, things like growth hormone peptides like sermorelin, which has been more studied for, let's say, like growth issues or specifically growth hormone deficiency, will actually improve growth hormone levels. And I've seen that time and time again. So sermorelin is great. CGC ipamorelin, it will stimulate the not only a bigger release of actual growth hormone naturally, but it'll also prolong that release. So not only do we have a big spike in the production, but it stays longer in the system. And then testosterone is just like the next level up. It's also a little bit more expensive. So I always say, like, let's ease in with sermorelin. If we're getting the desired effect, let's stay with it. And if not, we can move on to CGC ipamorelin and testosterone.
Talk to me about some of the other, I'm going to call them vanity peptides, right? Because again, it's like I keep thinking, like, I believe when a woman looks in the mirror and loves what she sees, it's like we're paving the path to feeling sexually alive. And
Of
it's a
course.
path that we approach from two ways. Like for some women, feeling sexually alive allows them to improve their body image. And for other women, it's like, I gotta look the way that I want to look before that's available. So you talked about hair growth, there are some for skin health. Like, what else
Yeah.
is out there? And one of the things that I really love for you to chat about, because I see peptides like all over social media, and it seems like people can just access them on their own without a physician. So I want you to also talk to us about caution and why it's important to work with somebody that knows what they're doing rather than just, I don't know, checking out something that a fitness influencer said is a good idea.
Totally. So many important points. I think it's important to do what's right for you, right? A lot of women will say, oh, we should just feel comfortable in our skin regardless of shape, size, age, etc. And I think that's so important, which is why it's brilliant. What you're doing is it's an inside out approach. We've got coaches and therapists. We're approaching it from a mind perspective, from a physical perspective. But then if someone does feel like their hair is stinging, right? And there's nothing wrong with wanting to have more hair. There's nothing wrong with wanting to not have cellulite. There's nothing wrong with wanting to look a little bit more lean and muscular. Those are okay things, and we don't need to justify why we want those things. And I struggled with hair loss for so long, especially having history of Hashimoto's and thyroid issues, that peptides were a lifesaver for me when it came to trying to regain some of the hair loss that I lost postpartum and having the autoimmune component. So, from a hair perspective, growth hormone peptides are amazing because growth hormone peptides, they stimulate our own collagen regeneration production, so they're very effective in helping improve hair thinning and hair growth. So that's number one. Number two, I really love using topical peptides. So this could be something like a PTD foam. It's usually paired with some other peptides. I also like topicals like copper peptides that are usually paired with thymulin and zinc. And these are great peptides to incorporate, especially when we're having a hard time retaining follicles. So we might be able to grow the hair, but it falls out. So even when I'm looking at hair growth as an example, there are multiple phases. Now, phase number one is we got to just stop it from falling out. That's step number one. Stop the bleeding. Stop the hair from falling out. Number two is we want to start seeing growth, right? This is where you blow dry on your hair and you've got the little things, little spikies. And then you're growing a mullet. And that's phase three, is making sure that those hair follicles, we're retaining them. Because if we're not, when we add something like the copper peptides, GHKQ paired with thymulin and zinc, that is what's protecting the hair follicles from just the internal and external stress, and which our hair follicles are very sensitive to that. They're delicate to some extent. There are different treatments, a little bit more progressive, and you do have to know where to get these therapies, but something like even exosomes can be very helpful when used with microneedling. So when it comes to our skin, I do love peptides like Argirelox, which it's also a combination of a few different peptides, but it's been known as like a Botox cream. And I usually have women apply it before bed. But what it does, unlike Botox, which we know is a toxin and neurotoxin, and a lot of people don't like it. So if you don't like Botox and you want to do a more natural route, Argirelox is one of my favorite peptides. It relaxes the skeletal muscle of the face, which is why it's known as the Botox cream. Also, copper peptides. Copper peptides paired with thymolene and zinc topically are also very beneficial, or just copper peptides on themselves, but by themselves. A lot of skincare products have them. And I think when it comes to skincare, it's totally fine to use topical peptides. Some are definitely better than others. So you don't necessarily, cheaper is not better when it comes to peptides. And when we are really looking to improve, whether it's skin appearance or skin firmness, or we're trying to stimulate hair growth, my preference is to go to a reputable source like a compounding pharmacy and get it in a compounded form. Most of the hair products and even skin products that we get from a compounding pharmacy need to be refrigerated. They're preservative free, and their shelf life is not 6 months, it's 30 days. There's a reason for it. And this kind of brings me to the next, your next question, which is where do we get them? And should we just be getting them online? Peptides are going through a boom, and it's great that we have access to them now more than ever before. Some people see it as like a new therapy. It's not a new therapy. The GLP-1s have been studied since the 1970s. Sermorelin has been FDA approved since the 1990s. VPC was first discovered in Croatia in the 1990s. We've had these access to peptides for a very long time. It's just that now with the medical advancements, which is how it should be, we have them more available to consumers. But that comes at a cost, right? Of potentially getting a product that's not for human use, that's in maybe the research state or the research stage of things. So when it comes to topical serums and creams, I think it's fine that if people are, like Fullscript has some topical serums that you can use for hair as an example. And I've actually had really great success in Thinywell. I have zero associations with them, just like their product. But some of their hair serums work very well. And I've had it from professional experience. My patients have had good results with them. When it comes to nasal sprays or injectables, anything that can cross the blood-brain barrier or is in your bloodstream, please, let's avoid the research labs that are coming out with these peptides that, one, you can either have a negative reaction, which is scary because it can go anything from being a mild reaction or it can end up in the ER, or you waste your money and you think that peptides are a scam, right? When you did not go through a reputable source or work with a physician to help you walk through the different peptides that are available on the market. And I know I'm talking a lot about this, but the last one I would mention, and this isn't vanity, this is actually like, how can we feel amazing? And that's oxytocin and PT141. Oxytocin, I've personally tried it. I've also had patients who are obviously on oxytocin. It's our feel-good hormone. It's the bonding hormone. If I would reach out and give you a big old hug because I haven't seen you in so long and I love you so much, we would get that oxytocin release. Oxytocin, we can get it in a nasal spray form, and it can cross the blood-brain barrier. And the effect is that it can improve our mood. It can improve our ability to manage stress. It can actually curb sweet cravings and food cravings. So it has this appetite control component, has anti-inflammatory component, brain protective, neuron protective, and helps the libido too. So PT141 is great for igniting that sexual desire and intimacy and improving circulation and blood flow to the reproductive organs. works differently than testosterone. So PT141 really activates the part in our brain and affects um, certain pathways that are more aligned with desire compared to testosterone. But a lot of women experience negative side effects like nausea. So a little bit counterproductive. We want to be into it and intimate, but then we're feeling nauseous.
Not
So
the time to be nauseous.
yeah.
God, it's so great because like I said, I just think I think we should just celebrate and embrace the vanity side of medicine for those who want it, right?
Totally.
There's
It's
something
there.
for everyone. Elena, what do you think about the oh, let me figure out how I want to phrase this. Like over-the-counter estrogen and progesterone. I'm starting to see in natural grocery stores. And for the sake of like these people listening, like I'm all for being proactive about your own health. Proactive is the name of your clinic. I know that you're about being proactive for your own health. How do we help people navigate the pursuit of radical vitality and safety?
You always should have a healthcare provider on board. It doesn't have to be me. It can be someone else, right? There are many great healthcare providers, and there's someone for everyone. When you're dealing with something like hormone replacement, and I think it's actually kind of scary that those things are available just over the counter, because when I think about my patients who are on hormone replacement, I'm monitoring those levels and I'm making sure that we're incorporating them in safe doses. I've seen women, since we're talking about this, who bought an over-the-counter estradiol, not estriol, estradiol cream. It was developed by a plastic surgeon to improve and reduce the appearance of premature wrinkles. And my clients, her estrogen levels, estradiol levels, went from like 150 to 600
Wow.
over a few months. And this is just from a topical estradiol cream, small percentage. She's in perimenopause. She wants to be proactive about it, right? And started applying to her face and also to the chest area, which is kind of scary. We don't want to just like saturate those receptors in the very sensitive area of our body. And if this was someone who was not working with a physician and just kept applying estrogen without having all the help from the other hormones, going back to what I said earlier, estrogen proliferative function, not in a bad way, like supports uterine lining as an example, right? But when it's left unchecked, it can have some negative consequences, and not necessarily breast cancer, but other consequences as well. So I really think that it's important that if someone is using these over-the-counter creams, if they feel great on them, I would still go through the healthcare provider who is monitoring their hormone metabolites to make sure that they're being used safely, that there are no inactive ingredients that could be doing more harm. Because when we're working with, let's say, compounding pharmacies that are compounding the creams, they usually, the reason why it's compound usually doesn't have all that crap in it, so to speak, right? That some of the more conventional prescriptions have. So we want to make sure that it's compounded correctly in a safe dose, that we're monitoring it to make sure that we're doing it in the most safe manner possible. And we also want to make sure that that cream does not come with other things that it shouldn't have.
Great. Thanks for your opinion. I know I kind of put you on the spot with this
No, that's
information.
okay. Very reasonable.
I appreciate it. So, okay, then coming back to sexual desire and vitality, are there other things that you're like, oh, you know what, this is like a really important piece of my toolkit that we didn't talk about? We talked about the hormones, we talked about that really holistic, comprehensive approach that only comes after the foundational steps. And we talked about the cherries on top, but is there another branch on this tree that you think really warrants like being added to the conversation so that that woman who wants to want to knows all of her options?
Totally. Thank you so much for asking me that. We talked a lot about hormones in general. I think hormone delivery is really important to talk about because you could have really good, let's say, testosterone levels, right? Maybe your testosterone was low and that was the reason why your libido was a little bit low. And then you start applying testosterone and your levels go through the roof. And maybe you're feeling like your energy is better and you're getting better results at the gym, but your libido is still low. And maybe if you're applying the testosterone cream, let's say behind the knees or on your skin, or maybe you had an injectable form of testosterone. Sometimes I see actually vaginal application work better when it comes to libido. So this is for women who, let's say, cannot do a testosterone pellet, because when we put women on testosterone pellets, their testosterone, let's say, goes from like 40 to like 150 to 250. I can't handle those levels. Those levels will make me go bald and break out like a teenager.
Mhm.
Some women can handle those levels and it can improve all aspects of their life, including their libido, because their levels are so high. But for women who are, let's say, for women who are applying testosterone cream, but are not getting the results like improved libido, the route makes the difference. And sometimes the intravaginal route in the form of like a testosterone tablet can be really helpful.
Oh, tablets, not creams.
I love not a lot of pharmacies will do tablets. And I really like tablets. They're less messy
Mhm.
and fewer chances of clitoral enlargement, which is what we have to think about when we're talking about testosterone cream. I don't like women to apply it near the clitoris because there is that risk of irreversible changes that can happen. But when you're doing the tablet, you're getting it closer to where you want the action to happen without the risk of enlargement.
Fantastic. Thank you for that. And then, okay, so follow-up question, since we're talking about routes of administration. The
Yes.
public service announcement for women using estrogen or progesterone as a cream whose partners don't need estrogen
Oh,
and
yes.
progesterone, then
Thank
let's
you.
talk about timing and administration with concern for others.
Thank you. That is very important after intercourse. So, as an example, a lot of things like, let's say, estrogen cream or estrogen suppositories, or even progesterone, testosterone, anything intravaginal, as an example, usually after intimacy, so that way we don't share it with our partner. If we're doing even a topical cream, like I apply my testosterone cream on the inner elbow or behind the knees, but I want to make sure that I don't apply it and then go hug my son or hug my husband, right? He's already on testosterone. He does not need any more. I'm just trying to keep up with him. As an example, usually when we're doing like morning application, within 7 hours, it's absorbed and we don't have to worry about it as much. So, but if it's more of an evening time application, for example, anything intravaginal is usually applied before bed because we don't want to be walking around with a melted cream all day. Not pleasant. We want to make sure that we're inserting things after intercourse.
And if you're going to have morning intercourse, then as long as you sleep
Right.
8 hours, you're probably good, right? It's that 7 hour
Yes.
window. Thanks so much for saying that, because it's just like we're going to be talking to a lot of people who aren't working with me or you, right? And it's like whoever you're working with, I find these are conversations that get stepped over.
I love that.
So I had
Love
somebody
it.
come to me and say, "Oh, I heard that as long as I wait 30 minutes, it's fine." And I was like, "Let's
No, it's
not."
starting to peak.
Yeah. Great. Okay. Elena, tell us about your hormone course and how women who are listening can get more of you.
Yeah, absolutely. So if you go on drelenazinkov.com, I've got my Hormone Potential Foundations course, which is great if you're just curious about what you should be asking your healthcare provider to test and what are the different ranges that you should be looking at, because so many women get dismissed that what they feel is normal and their labs look normal, but that is just an average. Labs are an average. And what I'm really trying to teach women is that there's an optimal range that we should be looking at. And I also have my actually bioidentical hormone replacement course on my website. This is great for women who are looking to learn where to find different healthcare providers, as well as where do you start when you're thinking about hormone replacement. So, a little bit for everyone.
Great. Thank you so much. We're going to post links to all of that. You have a fantastic Instagram page that I also want to recommend that people follow. And yeah, do you have any closing thoughts? Anything that you just wish people knew as they go out and really explore desire from a new lens?
I just think it's amazing what you're doing here. So, for those who are listening and watching, I had a pleasure to listen to you talk. And we were at a hormone conference. The theme was both women's and men's health. And when you are in these conferences, there's a lot of science, there's proof, there's validation, there's treatments, there's protocols. I mean, I'm surprised we're not all falling asleep, as exciting as it is. And when you started talking, for me, it was such a synergistic force of everything that we talked about that weekend because you talk to the humanity, to everything that we're doing, because we can talk about formulas and dosing and routes and energy and sleep. But when you started to talk about vitality, and feeling alive and the things that we should be talking to our patients about, it really resonated with me because I talk about those things with my patients, but a little bit because I'm busy doing some other things. But what I appreciate is the work that you're doing in the world, and it's really helping us feel more alive and in tune with ourselves.
Well, thank you for that. And thank you for sharing your wisdom. It's just such a great resource. And I'm really, really, really happy to have you included in this.
Thank you so much.